I think one of the things that all of us have had to get used to in recent months is doing things online. And one of the things that you can do online with more ease nowadays is telemedicine. Today we're going to be talking with Dr. Walt Whitley. Dr. Whitley will discuss topics about telemedicine as well as general dry eye health. Dr. Whitley?
I want to talk to you.
Not now, later.
No, now.
All right, thanks everybody for being here and welcome to the show. Today we're going to be talking with Dr. Walt Whitley of Virginia Eye Consultants. Dr. Whitley, thank you for being with us.
Hey, thanks for having me. Excited to be here.
Dr. Whitley, could you take a minute to tell us a little bit about yourself, your background, and your specialty?
Yeah, you bet. I'm the Director of Optometric Services at Virginia Eye Consultants in Norfolk, Virginia. And I actually wear a different hat as the Director of Professional Relations for CBP physicians in the Mid-Atlantic area. And so my practice, I do see patients about 3 to 4 days a week. And the rest of the time is more of an administrative role where I am helping with business development, working on professional relations, and doing a lot of clinical research and education on those admin times. And so I love what I do. I get to do a lot of everything, and I'm glad to be part of my practice where I am right now.
Wow, that sounds very exciting. So in the practice that you're at right now, do you consult with a lot of pre-surgical patients?
Yeah, we see a high volume of surgical patients within our practice, whether it's in my clinic, whether it's with one of our surgeons. We have about 20 providers within our practice. We have about 6 cataract surgeons, a couple glaucoma, a couple oculoplastics, a couple retina, several general ophthalmologists, and as well as the OD team of about 7 providers. And so we do have a large referral network, which we rely on to help prepare. When you say pre-surgical patients, we rely on our referring doctors to help prepare the patients before the surgery, educate patients about the various procedures, and that way when it's time for the patient to come in for their surgical consult, that the ocular surface is well prepared, but the patient's well educated to help make those once-in-a-lifetime decisions whenever they're coming in for surgery.
You know, when you're having these consultations and you're talking about, improving the ocular surface before surgeries, what kind of steps are typically taken to help prepare for surgery?
Yeah, well, one of the things that we do within the practice is, of course, you have to look at ocular surface disease. With all of our patients that come in, they do get a speed questionnaire. We want to understand how their eyes are feeling. Yes, we have the quality of life questionnaires as well for the cataracts. But when it comes to the ocular surface, we want to know how severe their condition is, how frequent the symptoms are, and establish a baseline for those patients. If they score 6 or higher, those are patients that we want to get into the dry eye protocol, address the surface. Yes, they may have cataracts, and some of our cataract surgeons, if they're seeing the patients themselves, they will address the surface issues, tell the patients, hey, I'm excited to do cataract surgery on you, but first we need to address the ocular surface. Then we'll have you back, we'll repeat the various measurements, and with the improved surface, we'll have optimal measurements to help them make the IOL calculations to get patients the best vision possible. And so I have some surgeons that like to do that. I have other surgeons that they just like to do the cataract surgery. They'll recognize the surface, but then they'll hand the patient off to myself, and they'll tell the patient, hey, I want to introduce you to Dr. Whitley. Dr. Whitley is going to address your dry eye. And once he feels you're ready for surgery, then he'll get you back into my clinic where we will get you ready for the procedure. And so that's how we do it within our clinic. If it's my own patients I've been seeing for a while, this is something that I'll just let them know, hey, you have some early lens changes. Eventually you're going to need cataract surgery. But before we get there, we need to improve the surface to help get the calculations, as I mentioned. But also, we have to address any of the blepharitis or bacteria on the eyelids to make sure we minimize any risk for infections during the procedure.
How often would you say that a patient comes in and has issues? So if we're doing these tests before surgery, how often does it come out that, oh, they're perfect, they can go right in today? And how often is it that there is corrective action that needs to be taken?
Everyone has dry eye until proven otherwise. And so if we identify it before the procedure, it's the patient's problem. If we wait to identify the surface issues after the procedure, whether it's an unstable tear film, fluctuating vision, then it's our problem because we did not recognize it before the procedure, did not address it, and now the patient says, hey, that was due to my cataract surgery, where we know they've had dryness the whole time. There's various studies, we're all familiar with the PHACO study, where almost 80% of patients had level 2 dry eye or higher. We know there's the other study out of Duke with about 120 patients where 80% had at least one abnormal tear test. And so we do know it's a highly prevalent condition, but we have to look for it. And we also have to ask patients the questions. And yes, we like the cataracts, we like to do the glaucoma, but we have to take care of that surface.
Well, and how painful is that process in terms of what you're going through to get the surface corrected? I would imagine sometimes it's an easy fix, sometimes it's more difficult. And how do you go through that process?
Well, it's all about setting expectations for the patient. Let's say the patient's had dryness for some time. Those are patients we're going to say, hey, yes, we need to get you ready for the procedure, but this may take some time because you've had dryness for years. I'm not going to fix it in a month or a week. I may not fix it in a month, but I'm going to treat you according to whatever algorithm that whatever the providers use or what I use. And once we get you stable, then we'll get you, or improved surface, then we'll get you in for the further calculations.
Very good. Well, and I think one of the things that's top of mind with everybody nowadays is what's been going on with the pandemic and COVID-19. How has your practice been impacted by COVID-19?
Well, right now we're pretty busy. I can tell you that because, we fortunately have a very busy practice already. But when you have that shutdown, like many of us are experiencing, we had to delay that gap of patients during the closures. But then we already had a busy schedule already. And so we have to find a place to add these patients into. And so doing that, taking social distancing into account. There are definitely some challenges, but it's an opportunity for our practices to identify new opportunities, to reinvent our practices, doing new things within the practices that maybe we weren't doing before, or maybe not as efficiently before. And so it's an opportunity for us just to take our practice to the next level. And that's how we've been looking at it, is saying, hey, this is our opportunity just to get better.
And I think to some degree, I think we would all agree that some of these steps are not necessarily a bad thing, even outside of the pandemic.
Mm-hmm. Yeah, exactly.
So Dr. Whitley, I know that you write in collaboration with a number of professional journals. And first of all, I don't understand how you do all of that with everything else you're doing. But what would you say is the biggest topic in the industry right now?
Well, other than COVID that you just asked me about, is we're hearing a lot about telemedicine. And when it comes to telemedicine, it's been around for many, many years. Typically in eye care, when we think of telemedicine, we're thinking about diabetic retinal photos that go to a reading center. And if there's diabetes detected, then they're getting sent off to an eye care provider. But with telehealth, this is something that, we had to have a way to reach out to our patients, and especially since we're talking a lot about ocular surface, a lot of our ocular surface disease patients, they wanted a way to still connect with us. They wanted to see, hey, are the things that they're doing are right? Is there anything that we could do to modify their treatment? Yes, we can't see their eyes, we can't do the stain, we can't express the glands, we can't utilize any of our point of care testing, but we still have access to the records. We know what they've tried, what they didn't try. We know the various treatment options that are available. And so we can add in various therapies, whether it's short-term or long-term. We know we have, oftentimes, here's a great example, is we may have a patient that's on lifitegrast, or maybe they're on cyclosporin, that is, they've been fine for a while, but they're having some issues, maybe some stickiness in the morning. And so, one of the things that comes to mind with the stickiness on the eyelid is, blepharitis or a biofilm that they may have. And so prescribing some lid scrubs, or doing the, one of my go-tos is hypochlorous acid, with easy treatment for them. They just spray their eyes and clean off the eyelids. And so that's something that they can do. And then we can follow up with them in a couple weeks to see how their progress is. And so whether it's with ocular surface disease, although it's not the same as having an in-person eye exam, there are many things such as a sty, that we could utilize. Patients that have glaucoma. I mean, we were more severe glaucoma patients we were still seeing during the pandemic. The retinal patients that need the injections, our retina surgeons were still very busy, but we could still utilize the diagnostic test, having patients come in for an OCT visual field pressure check, but then we can call them afterwards and review their results, call in medications if needed. And so it's just another opportunity for us to connect with our patients and still provide care. And now where do we go with telehealth from here? That's all up to us. And so we actually still have a provider each day that's offering some telehealth services for our patients, but then we're also looking at ways that we can utilize telehealth in the parasurgical arena for progress checks on our patients to see how they're doing. And so we're doing some pilot projects within our practice right now, and it's been working very well.
You know, Dr. Whitley, maybe you could walk our viewers through how a typical visit, so to speak, would be in telehealth. You know, what can they expect when they're trying to communicate with their doctor via telehealth?
From the patient's perspective, I mean, essentially, when you're calling the practice, someone will get you scheduled for a telehealth visit. And so there'll be a scheduled time where, let's say 9 o'clock, I'd give you a call at 9 o'clock. And we just talk about exactly whatever you're experiencing. Let's say you did have a swollen upper lid and there was a tender bump on there. You know, I'd take a look at it. You know, I'd ask you various questions, what you've already tried before. We try to get the best vision that we can. It's hard for me to test I don't have a Snellen chart or way for you to tell me if you're 20/20 or not. But you can look across the room and tell me, hey, you know, I can ask you, is your vision the same? Is it better or worse than before? Are you having any other symptoms that are going on? And then I can help narrow down the various diagnoses just through the various history. And then I can also have you take a magnified view with your phone, and you can blow it up and take a picture of your eye and show it to me, and it'll help me determine what's going on. It doesn't work for every condition, but there are many conditions that it does work for. And so that's essentially what you'd expect. Based on what the diagnosis would be, if I need to call in a prescription for you, I'd call it in and you go pick it up from the pharmacy. And then we'd schedule another telehealth visit to make sure you're better.
You know, I think I can tell by your conversation that telehealth is something that you're interested in. You know, from a doctor's perspective, how do you feel about telehealth? Are you happy with this? Is this something that you'd like to see expand?
This is something that in our practice, we're going to embrace it. I mean, technology, as we know, is here to stay. And whether it's telehealth, whether it's going to be through artificial intelligence, because that's a buzzword we're hearing a lot about as well. Technology is only going to get better. But there's always going to be a need for providers to interpret that data, have that doctor-patient relationship, and help that patient address any other conditions that they may be facing. And so, from the doctor's perspective, for us, this is something that we are excited about, that we want to embrace, and that's why we're always finding other opportunities to help us reach out to our patients and take care of our patients. Because we know it is convenient, it is very efficient for our patients. You know, one of the things that we do with the telehealth as well is, let's say we do have a patient that comes into the practice and we say, well, we'll prescribe this medication for you, but you don't necessarily have to come in a couple weeks. We can check in on you in a couple weeks and schedule for a telehealth visit. And from the provider's perspective, we can still build that accordingly. And just as like an in-office exam, as long as you're meeting all the various billing criteria. And so it's just another way to provide care for your patients. One of our referring doctors, you know, with the social distancing, they were trying to figure out, well, we only have X amount of rooms. We have this many providers, this many techs. We're trying to have a hard time trying to figure out how to get everybody in clinic and get everybody going. And so I said, well, what about telehealth? You can get the patients come in, you can have one doctor in practice, you have one of the technicians do all the various tests, and the other one can schedule patients for telehealth on a different schedule, and you're still providing the care, social distance, and taking care of the patient's needs. So,
Well, I would certainly see that being something. I know myself, I've actually used telehealth recently, and I found it to be a very painless process, actually. And frankly, I think in a lot of ways, it sort of removes some of the barriers for patients that may not have the time to go to the doctor or may not want to make the drive or whatever it is. So it seems like taking those barriers away would just, help contribute to patient health.
Yeah, definitely.
Well, Dr. Whitley, I won't take up any more of your time. Thank you so much for being with us today and taking the time to answer all these questions. And we'll look forward to speaking to you again real soon.
All right. Thank you so much. Have a great evening.